and welcome to new informative video, the reason for all your health and wellness information. Today we will learn about the topic that is blood pressure. High or low blood pressure can affect anyone. So it's crucial to understand what are the causes, symptoms, diagnosis and treatment of blood pressure. In this video we will explore everything you need to know how to maintain a healthy blood pressure. To begin with, let's first understand what is blood pressure. So blood pressure is the pressure of circulating blood against the walls of blood vessels. Most of the pressure results from the heart pumping blood through the circulatory system. Blood pressure is one of the vital signs together with respiratory rate, heart rate, oxygen saturation and body temperature that healthcare professionals use in evaluating a patient's health. Blood pressure that is too low is called hypotension. Blood pressure that is consistently too high is called hypertension, and the normal pressure is called normotension. Now let's see how to understand the high blood pressure readings. In blood pressure reading, there are two things, systolic pressure and diastolic pressure. So systolic pressure is the top number and it indicates the pressure in your arteries when your heart beats and pump out the blood. And diastolic pressure is the bottom number and it is the reading of the pressure in your arteries between beats of your heart. So both numbers are important to monitor and keep in control. So normal blood pressure range is 120 by 80 mmHg or lower. Elevated pressure is 120 to 129 mmHg. The top number and bottom number is not above than 80 mmHg. Stage 1 hypertension, top number ranges from 130 to 139 mmHg and bottom number range from 80 to 89 mmHg. Stage 2 hypertension, the top number is 140 mmHg or higher and bottom number is 190 mmHg or higher. So blood pressure that is higher than 180 by 120 mmHg is considered a hypertensive emergency or crisis. Now let's talk about what problem does high blood pressure actually cause. So high blood pressure can damage your health in many ways. It can seriously hurt important organs like heart, brain, kidney and eyes. The good news is that in most cases you can manage your blood pressure to lower your risk for serious health problems. Now let's talk about heart attack and heart diseases. So high blood pressure can cause damage your arteries by making them less elastic, which decreases the flow of the blood and oxygen to your heart and leads to heart diseases. So in this condition, decreased blood flow of the heart can cause chest pain, which is also called angina, heart attacks, which happens when the blood supply to your heart is blocked and heart muscles begin to die without enough oxygen. The longer the blood flow is blocked, the greater the damage to the heart. Heart failure, a condition that means your heart can't pump enough blood and oxygen to your other organs. Then comes the second, and that is stroke and brain problems. High blood pressure can cause the arteries that supply blood and oxygen to the brain to burst or be blocked, causing a stroke. Brain cells, they die during a stroke because they do not get enough oxygen. Stroke can cause serious disabilities in speech, movement and other basic activities. A stroke can also kill you. So having a high blood pressure, especially in midlife, is linked to having poorer cognitive function and dementia later in life. Next is kidney disease. Adults with diabetes, high blood pressure or both have higher risk of developing chronic kidney diseases than those without these conditions. Now let's talk about what causes high blood pressure. So there are two types of hypertension and each type has different cause. So let's talk about the first, that is essential or primary hypertension. So this type of hypertension, it tends to develop gradually over many years and it is caused due to multiple factors. So number one is genetic. Some people, they are genetically predisposed to hypertension and this may be from their genetic mutations or genetic abnormalities inherited from their parents. Number two is age. So individuals over 65 years old are more at risk of hypertension. Number three is living with obesity. So living with obesity can lead to few cardiac issues including hypertension. Number fourth is high alcohol consumption. So people who have more than 2 drinks per day may be at an increased risk of hypertension. Then comes living with a sedentary lifestyle, which means lower level of fitness have been connected to hypertension. High sodium intake. So there are small association between daily high sodium intake. So more than 1.5 gram a day can lead to hypertension. And last but not the least, living with diabetes or any other metabolic syndrome. So individuals who are diagnosed with either diabetes or metabolic syndrome, they are at a higher risk of developing hypertension. So these were the causes of primary essential hypertension. Now let's talk about what are the causes of secondary hypertension. So secondary hypertension can often occur quickly and it can become more severe than primary hypertension. And several conditions include like kidney diseases, problems with your thyroid, side effects of medication, obstructive sleep apnea, congenital heart defects, certain endocrine tumors, etc. So till now I have explained you about what is blood pressure, what causes blood pressure, what blood pressure can do to you, and how to read the measures of the blood pressure. And now let me enlighten you with the lifestyle tips to lower your hypertension. Number one is add fruits and vegetables to your diet. So eating a diet rich in whole grains, fruits, vegetables and low fat dairy products and low in saturated fat and cholesterol can lower the high blood pressure. So slowly work your way up to eating more serious of heart healthy plants. Aim to eat more than 7 servings of fruits and vegetables each day. The aim is to add 1 more serving per day for 2 weeks. So you can include leafy greens, berries, skim milk, yogurt, seeds, dark chocolates, pistachios, olive oil, pomegranate, etc. Number 2 is limit refined sugar. So eating too much sugar can inhibit the production of nitric oxide in blood vessels. Nitric oxide, it normally helps in vasodilation, that is expanding of the blood vessels. So without nitric oxide, it leads to vasoconstriction, that is narrowing the blood vessels and can lead to high blood pressure. So try to limit the number of sugar sweetened foods like flavored yogurt, cereals, sodas and things you eat on daily basis. Packaged foods, high unnecessary sugar, so be sure to read the labels. Let's talk about third point, that is reduce sodium intake. So salt makes your body hold on to water. If you eat too much, the extra water in your blood means there is extra pressure on your blood vessel walls, raising your blood pressure. So people living with hypertension and those with an increased risk for heart diseases may be advised by their doctor to keep their daily sodium intake between 1500 mg and 2300 mg per day. So the best way to reduce sodium is to cook fresh foods more often and limit the amount of fast food or pre-packaged food you eat, which can sometimes be very high in sodium. Then comes the fourth point, that is set weight loss goals. So if your doctor has recommended you to lose weight, talk with them about an optional weight loss goal for you. The Center for Disease Control and Prevention, they have recommended a weight loss goal of 1 to 2 pounds a week. This can be achieved more than nutritious diet and increased physical exercises. So employing the help of a trainer or fitness app and possibly even a dietitian, you can take all the methods to help you learn how to make the best choices for your body and your lifestyle. Then comes the fifth point, that is monitor your blood pressure regularly. So the best way to prevent complication and avoid problem is to recognize hypertension early. Keep a log of your blood pressure readings and take it to your regular doctor appointments. This can help your doctor see any possible problems before the condition advances. Then comes next point, that is increasing physical activity. So in addition to helping you lose weight, exercise can help lower blood pressure naturally and strengthen your cardiovascular system. So aim to get 150 minutes of moderate physical activity, that's about 30 minutes 5 times per week. Next comes managing stress. Now the body releases a surge of hormones when under stress. And these hormones cause the heart to beat faster and the blood vessels to narrow. These actions increase blood pressure for a time. But reacting to stress in unhealthy ways can raise blood pressure and increase the risk of heart attack and stroke. So behaviors linked to high blood pressure include drinking too much of alcohol or caffeine, eating unhealthy foods, not moving enough, eating too much. So exercise is a great way to manage stress, and other activities can also be helpful, which includes meditation, tree breathing, muscle relaxation and yoga. Now comes the last point, that is quitting smoking and limiting alcohol. So if you are a smoker and have been diagnosed with high blood pressure, your doctor will most likely advise you to quit. The chemicals in tobacco smoke can damage the body's tissue and harden the blood vessel walls. And if you consume regular high much of alcohol or have an alcohol dependency, seek help to reduce the amount you drink or stop altogether, because drinking alcohol in excess can raise the blood pressure. So to conclude, understanding and managing your blood pressure is crucial for your long-term health. Regular checkups and a healthy lifestyle can make a significant difference. Remember, it's a journey, not a destination, so stay committed to maintain a healthy blood pressure. That's it for the video today. If you found this information helpful, don't forget to give it a thumbs up and share the video with your family and friends, and subscribe to our channel Nick Neha Vlogs for health related content.